Feeling overwhelmed by anxiety? Benzodiazepines could be the solution you're looking for. In this video, we'll explore the effectiveness of two widely prescribed medications for anxiety disorders, Lorazepam and Clonazepam. Understanding anxiety disorders. Anxiety disorders are a common mental health condition affecting millions of people worldwide. It is characterized by persistent feelings of worry, fear, and unease that can significantly impact a person's daily life. These disorders can manifest in various forms, such as generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias. Living with an anxiety disorder can be challenging, but fortunately, there are treatment options available to help manage the symptoms. One such option is the use of benzodiazepines, a class of medications commonly prescribed for anxiety disorders. Benzodiazepines, an overview. Benzodiazepines are a class of psychoactive drugs that work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. GABA is responsible for inhibiting the activity of neurons, thus producing a calming effect on the central nervous system. These medications are known for their sedative, hypnotic, anxiolytic, anticonvulsant, and muscle relaxant properties. They are typically prescribed for short-term use due to the risk of dependence intolerance that can develop with long-term usage. Lorazepam and Clonazepam are two commonly prescribed benzodiazepines used to treat anxiety disorders. While they have similar mechanisms of action, there are some important differences between the two. Lorazepam, uses and benefits. Lorazepam, sold under the brand name Ativan, is a fast-acting benzodiazepine that is commonly used to treat anxiety disorders. It is also prescribed for other conditions such as insomnia, seizures, and alcohol withdrawal. One of the main benefits of Lorazepam is its rapid onset of action. It starts working within 30 minutes to an hour after ingestion, providing quick relief for acute anxiety symptoms. This makes Lorazepam an ideal choice for situations where immediate relief is needed, such as panic attacks or severe anxiety episodes. In addition to its anxiolytic properties, Lorazepam also has sedative and muscle relaxant effects. This makes it useful for managing symptoms of insomnia and muscle tension that often accompany anxiety disorders. However, it's important to note that Lorazepam has a relatively short duration of action, typically lasting around 6 to 8 hours. This means that multiple doses may be required throughout the day to maintain its effectiveness. Clonazepam, uses and benefits. Clonazepam, marketed under the brand name Clonopin, is another benzodiazepine commonly prescribed for anxiety disorders. It is also used to treat seizures and panic disorder. One of the main advantages of Clonazepam is its longer duration of action compared to Lorazepam. It has a half-life of approximately 30 to 40 hours, resulting in a sustained effect that can last for up to 12 hours. This means that fewer doses are needed throughout the day, providing more convenience for individuals with anxiety disorders. Clonazepam is highly effective in reducing anxiety symptoms, including excessive worry, restlessness, and irritability. It can also help to alleviate panic attacks, a common symptom of panic disorder. Furthermore, Clonazepam has anticonvulsant properties, making it particularly useful for individuals with comorbid anxiety and seizure disorders. It can help to control and prevent seizures, providing additional benefits for those who require dual treatment. Key differences between Lorazepam and Clonazepam. While Lorazepam and Clonazepam share similar mechanisms of action, they differ in terms of their duration and potency. Lorazepam has a shorter duration of action and is generally considered a more potent medication compared to Clonazepam. This means that Lorazepam acts more quickly but may require multiple doses throughout the day to maintain its effects. On the other hand, Clonazepam has a longer duration of action, allowing for fewer doses and providing sustained relief. The potency of Lorazepam can be advantageous for individuals with severe anxiety or panic symptoms, as it provides immediate relief. However, it may also increase the risk of side effects and potential dependence. On the other hand, Clonazepam's longer duration of action can be beneficial for individuals who require continuous anxiety control throughout the day. It provides a more stable effect and may be better suited for individuals with milder anxiety symptoms. Effectiveness and side effects of Lorazepam. Lorazepam has been extensively studied and proven to be effective in the treatment of anxiety disorders. It has a high success rate in reducing anxiety symptoms and promoting relaxation. However, it is important to note that individual responses to Lorazepam may vary. Some common side effects of Lorazepam include drowsiness, dizziness, and impaired coordination. These side effects can be more pronounced in the elderly or those with underlying medical conditions. Other less common side effects can include memory problems, confusion, and changes in mood or behavior. Long-term use of lorazepam can lead to dependence and withdrawal symptoms when discontinuing the medication. It is important to follow the prescribed dosage and duration to minimize these risks. Effectiveness and side effects of clonazepam. Clonazepam is also highly effective in treating anxiety disorders, with a success rate similar to lorazepam. It effectively reduces anxiety symptoms, including excessive worry and panic attacks. Common side effects of clonazepam include drowsiness, dizziness, and fatigue. These side effects are typically mild and tend to diminish over time. However, caution should be exercised when performing tasks that require alertness, such as driving or operating machinery. Clonazepam, like other benzodiazepines, can cause dependence and withdrawal symptoms with long-term use. It is important to follow the prescribed dosage and consult with a healthcare professional before discontinuing the medication. Choosing the right benzodiazepine for anxiety disorders. Choosing between lorazepam and clonazepam depends on various factors, including the severity of symptoms, medical history, and potential side effects. If immediate relief is needed, lorazepam may be a suitable choice due to its fast-acting nature. However, individuals who require continuous anxiety control throughout the day may benefit from clonazepam's longer duration of action. Additionally, individual responses to each medication can vary. It may be necessary to try both medications under the guidance of a healthcare professional to determine which one works best for an individual's unique needs. It is important to use benzodiazepines as directed and for the shortest duration possible to minimize the risk of dependence and other potential side effects. Regular communication with a healthcare professional is essential to monitor the effectiveness of the medication and make any necessary adjustments. Alternative treatments for anxiety disorders. While benzodiazepines can be effective in managing anxiety disorders, they are not the only treatment option available. For individuals who prefer non-medication approaches or want to supplement their anxiety treatment, there are alternative treatments to consider. Cognitive behavioral therapy, CBT, is a commonly recommended therapy for anxiety disorders. It focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. CBT has been shown to be highly effective in reducing anxiety symptoms and improving overall well-being. Other non-pharmacological treatments include relaxation techniques, such as deep breathing exercises, meditation, and yoga. These practices can help individuals manage stress and promote relaxation. In some cases, a combination of medication and therapy may be the most effective approach. It is important to discuss all available options with a healthcare professional to determine the best treatment plan for each individual. Conclusion: finding the best treatment option for you. Lorazepam and clonazepam are both effective medications for managing anxiety disorders. While they have similar mechanisms of action, they differ in terms of duration and potency. Lorazepam acts more quickly but has a shorter duration of action, while clonazepam provides sustained relief with fewer doses. Choosing the right benzodiazepine depends on individual factors such as symptom severity, medical history, and potential side effects. It is important to work closely with a healthcare professional to determine the most suitable treatment option. Additionally, alternative treatments such as cognitive behavioral therapy and relaxation techniques can be considered as complementary or alternative approaches to managing anxiety disorders. Remember, finding the best treatment option for anxiety disorders is a personalized process. What works for one person may not work for another. With the guidance of healthcare professionals, individuals can explore different options and make informed decisions to improve their quality of life and manage anxiety effectively.